This is Amelia Haviland. I'm a senior statistician at the RAND Corporation in Pittsburgh, Pennsylvania. You know, our study is the first comprehensive study to look at the question of the impact of CDHPs on healthcare costs. And it's a large study, 60 employers, tens of thousands of employees for each of these employers. And we find consistent evidence that CDHPs induce a reduction in spending on the order of 15 to 25% in the first year that people enroll in these plans. You know, consumer-directed health plans are a huge change in the employer-sponsored insurance market. It's a big change in the deductible levels that employees are exposed to. And so there's a big question as to how people are going to respond. The RAND Health Insurance Experiment, which looked at the effects of higher cost sharing, found that people reduced both necessary and unnecessary care. So we were very careful to look at high-value preventive care, and there is a note of caution that we found small reductions in use of that care for folks enrolling in these plans versus people staying in traditional plans. And that is the wrong direction. We do not want that kind of care to decrease. And it's troubling because that kind of coverage was covered at 100%. The deductible didn't apply. I would want policymakers to know that these plans do reduce spending. They reduce overall spending. It's not just a shift in costs, and that reduction is substantial. We're talking between 15 and 25%. The note of caution that we just don't know yet is what the implications of those reductions will be over time. It's a reduction in use, and whether those could lead to poorer health outcomes and to increased spending over time, or whether people will make clinically sensible choices.